So if anyone hasn't seen it yet, we just sent out a release. So it might be in your inboxes.
I beg your pardon?
We just sent out a release
Was it? Sorry.
that just hit your inboxes.
I have to use my phone for streaming. I can't read it, you know?
Shelter in place for Lauderdale County.
See, I told you I read that. I'd asked me earlier, she was like, we're not gonna tell you, we're not gonna tell you.
Okay, break the big news.
You don't like me. You're just so mean to me.
Oh, no, we're good. That's good. You did good. Thank you.
I love it when they text me. I'm like, you know, I'm using my phone to stream to the station.
I'll be down in the IFB, and then it'll be like 5 minutes till the show, and then the producer from the
I get that
call
too.
me, and I'm like,
It
okay,
frustrates me.
hang up from IFB to
Right.
answer this call.
Exactly.
But okay.
Or when the producer wants to talk about your 6 o'clock story and you're doing the 5, I'm like,
Right.
can you wait until I'm done?
Right. Well, you know, since we've got that 5:30,
Pointing.
we
What's
really,
the point?
Yeah, I know.
You're not the boss of me.
I mean,
oh, sorry.
yep.
Thank you all for being here, and thank you for your willingness to work with us on finding a venue that is more conducive. When we were talking about this yesterday afternoon, we were expecting pretty significant weather throughout Mississippi today. We have had some wind blowing today. Director Michelle was letting me know earlier, and he can answer any questions on that. We do think there was a tornadic activity down in George County. We do not believe that it hit the ground, although we do have wind damage, and we have people on the ground surveying that damage. And one thing, even with the challenges that exist with COVID-19, the wind doesn't stop blowing and the tornadoes don't stop, and what is typically April, one of our most challenging weather months in Mississippi. The primary reason for us being here today, other than our attempt to consistently update each of you on things that are going on every single day. Everything is moving very rapidly. It's ever evolving, and it's something that we know we have to continue to work to stay on top of. But the primary reason we're here today is to announce that in line with our strategy in dealing with COVID-19, I have signed an executive order, number 1465, which does issue a shelter in place for Lauderdale County and each and every one of the municipalities therein. This shelter in place order is issued for a number of reasons. As you know, our strategy, as was outlined last week, is to identify those communities where there are potential hotspots. I want to be clear, the fact that the first shelter in place is issued for Lauderdale County does not mean that they have the most number of cases, and it does not mean that they are the only place in Mississippi where there are challenges, but based upon the data that is being collected at the State Department of Health, they believed and they recommended to me that we do this. Keep in mind, our strategy is we are issuing the shelter in place. We have an end date, which is 14 days. Shelter in place in Lauderdale County will begin at 10 p.m. tonight and will open back up as it currently exists at 11:59 p.m. on April the 14th. We are not simply issuing a shelter in place in Lauderdale County and saying that's enough, we're done. As we had outlined last week with Dr. Dobbs, and Dr. Byers is here today to answer questions specifically about the strategy, and I know he'll do a fantastic job doing that. He and his team are working overtime to protect Mississippians. But tomorrow, we will have a team in Lauderdale County that will do a significant amount of testing. In doing that testing, we will implement our strategy of identify and isolate. And so with more testing, we will identify those who have the virus. We will care for those who need care at local hospitals. We will ensure that those who have symptoms but are not as bad, do not need hospital care, will isolate in their home. And then we will have caseworkers on the ground in Lauderdale County working each of those cases to try to determine with whom those individuals have come in contact with, and then we will potentially quarantine those who have had contact, whether or not they have symptoms, so as to slow the spread of the virus in that community. This is a strategy that we believe has worked in numerous other countries around the world, and we as a state find ourselves at a different point in this cycle, at a different point in this curve than some other states do. And so I want to be clear about that. The fact is that we are going to continue to do everything we can to let the data drive our decision making, not emotion or anything else. But I also want to be clear that this is the first shelter-in-place order that we are issuing from the state. But I do not anticipate that it's going to be the last. As I have said repeatedly, I am willing, able, and prepared to issue shelter-in-place orders wherever the experts tell me that they are needed. We continue to monitor and watch what's going on in the city of New Orleans, and we know that that has implications and ramifications for our Mississippi Gulf Coast region, and we are prepared to take additional action when the data warrants us doing so. This shelter-in-place order not only outlines the time that this order will be in place, it also requires, and by the way, we've worked with local elected officials over the last 48 to 72 hours. There will be no surprises by those local elected officials. This order does require that all non-essential businesses and operations cease. It also allows for essential business operations to remain open, but all of those essential business operations have to continue to work to comply with the orders already in effect, which includes no more than 10 individuals gathering for social reasons, maintaining social distancing, continuing to exercise a very good hygiene, as well as washing your hands and using hand sanitizer. We also have listed a number of prohibited activities, as well as outlined essential activities, essential travel, which in essence is to and from work, to and from getting medical care, to and from getting supplies for your home. And we've also allowed for county and local municipal authority to go even further should they decide that they need to do so. And we have delegated authority to issue and enforce quarantine and isolation orders to the Mississippi Department of Health. This is something that Dr. Dobbs has said repeatedly, and I know Dr. Byers can speak to this. This is something that the Department of Health does regularly with tuberculosis cases, etc. So this is an area that they are very comfortable with and very good at. And then we also have delegated and called for the enforcement of this order by all state, county, and local law enforcement in and around Lauderdale County. That will go into effect at 10 p.m. tonight. It will be in effect until April the 14th. There's a lot of other things that have transpired since we all last got together, and I do want to just briefly talk to you about a few of those. Obviously, the President signed the CARES Act, which was passed by the Senate on Thursday and by the House of Representatives in Congress on Friday. I will tell you that it was well over 1,000 pages. I asked for, from my staff, a summary of the bill. I received that summary of that bill, and the summary is 35 pages long. And so suffice it to say that we have a team pouring through the bill so as to ensure that we are able to take advantage of each and every provision that is in that particular piece of legislation. I can't tell you with certainty what every word in the 1,000 plus pages say, but I can tell you that we are committed as a state to take advantage of every provision that helps Mississippians. Every single one that helps Mississippians, we're going to take advantage of it. The one thing, in a few areas we do have some clarity. As you know, I met with Jackie Turner on Saturday, working with her and her staff at the Mississippi Department of Employment Security. We entered into an MOU with the United States Department of Labor. I had the occasion of speaking with the Secretary yesterday on a call with the President and the Vice President. We have entered into that MOU, which allows for us to take advantage of a few of the provisions in this particular act as it relates to unemployment insurance. There are 5 primary areas. Number 1, there is a pandemic unemployment assistance fund that will be treated similar to the disaster unemployment assistance and provides UI benefits to individuals who become unemployed as a result of this disaster declaration. Number 2, there's an emergency unemployment relief for governmental entities and nonprofit organizations. Currently, governmental entities and nonprofit organizations may not be eligible for their employees to receive assistance, but this provides relief. In addition to that, there is a federal pandemic unemployment compensation fund, which allows for the increase in overall benefits on a weekly basis compared to what your state's normal maximum is. In addition to that, as you all know, sometime in the last 2 weeks, I waived the first week of unemployment insurance requirements for all Mississippians. Before this pandemic occurred, every Mississippian had to wait at least 1 week before they were eligible for unemployment. We waived that. In this particular bill, the federal government's going to pick up the tab for that first week of unemployment. We're very thankful and grateful for that. That will help protect our trust fund long term. In addition to that, there is a pandemic emergency unemployment compensation fund that provides for the potential of additional weeks of unemployment for Mississippians on the back end of this particular event. Now, let me just speak to the practical side of what's going on at the Mississippi Department of Employment Security. While I was there, I believe it was Saturday night, about 7 o'clock, 7:15, we had individuals that were being trained, individuals that were working in their call center. They were appropriately practicing social distancing as they were in multiple cubicles that were very far apart. They were doing the right thing. But when this pandemic began, or let's just say on normal business hours, this call center at the Department of Employment Security was open from 8 to 5 days a week. Since that time, they have increased the hours from 8 to 5 days a week, to 7 to 7 days a week. So we've gone from 40-hour weeks to 84-hour weeks. In addition to that, we are looking at, and by we I mean Jackie Turner and her team, are looking at increasing the hours from 7 to 7 days a week, to 7 till 10 on certain days. Again, increasing the number of workers. We are hiring workers every step of the way. But what I want to say to Mississippians who may be unemployed due to this pandemic, that are having a hard time getting on the line, keep trying, be patient. We are working hard to solve all of the challenges that come from this, and you will get paid. And you will get paid based upon when you are eligible to get paid. All of these various things are going to require a recalibration of our computer systems and our computer model. That's going to take a few weeks. It's going to take at least 2 to 3 weeks on the federal government being able to actually get the money out because they've got to recalibrate their systems as well. But again, let me say, everyone is going to get paid what you are entitled to under the provisions of the Act. We are going to continue to work to get the challenges fixed. As a reminder, we had unemployment claims that were announced on Thursday in Mississippi. We're up 550% from the week before because of this pandemic. It's obviously a major challenge and one that we've got to work together to make a difference. In addition to the unemployment assistance that was in the bill that was passed by the Congress, I will also tell you that there was emergency relief for hospitals to the tune of approximately $130 billion in that particular bill. There was also a provision which will provide up to $150 billion for state and local governments and tribes around the country. As I appreciate it, and we're digging into the details now, of that $150 billion, approximately $11 billion of it is reserved for tribes. Approximately 45% of the additional monies are reserved for cities that have a population over 500,000, which unfortunately we have no city that qualifies for that. And the remaining 55% is allocated to the states based upon population. But there is a minimum floor which each state will receive, and that will put us in a position to receive some significant dollars which will go towards our recovery and will go towards our management of this particular emergency. We've done numerous other things, including working with our friends at MEMA, who are working with FEMA, which is the lead agency, in getting a major disaster declaration for the state of Mississippi. We're not there yet, but we're very close, working through the process, which will allow us potentially to get a higher match from the federal government on all expenditures that we are making. I think eventually every state's going to fit into that category, although only the president can ultimately make that decision. But given what's going on in the country and the number of cases that are rising, that seems to be likely from my perspective that every state is going to meet whatever threshold they have in place. In addition to that, we are working tirelessly with the supply chain to get more PPEs, to get more reagents, to get more testing kits. I am very pleased with the fact that with the University of Mississippi Medical Center coming online, not only with their testing site here in central Mississippi, but also their testing capabilities. They have done yeoman's work to get that up and operating. I actually spoke with Dr. Woodward this morning and thanked her and her team for their efforts. But the great thing about it is they not only have found a way to increase testing capabilities there, they're now looking at other avenues to further increase testing capabilities. That's happening there. It's also happening down in the Hattiesburg region with all of our research universities looking into this. Certainly University of Southern Mississippi and Forest General are working feverishly to get more testing capabilities as well. And those testing capabilities are critically important to Mississippi because our strategy of identify and isolate is dependent upon our ability to test. And so in our state, we have run what we believe to be in the neighborhood of 10,000 total tests. In a place like South Korea, for instance, which is considered a model for testing, my impression is they did 5,200 tests per 1 million residents. We're not that far behind, and we're really trying to focus as much of our testing here in the early days on those who are showing symptoms and those who are needing, who are symptomatic as opposed to those who are asymptomatic. So hopefully that is a strategy that is going to serve us well in the long term. And so with that, again, I want to thank you for being here today. I would anticipate that as we move along in this cycle, you will see us doing a more regular and more often briefings. Obviously, we have laid the groundwork. We have literally thousands of employees, state employees, public health employees, hospital employees, doctors and nurse practitioners, and those on the front line working hard every single day to prepare for what's ahead. I will say, I've said this from the beginning, and will continue to say it until I believe it's not true. We are still closer to the beginning of this than we are to the end. We have weeks to be dealing with this. It's not going to be over tomorrow. That's the question I get more than anything is, when is this going to be over? And I wish I could answer it for you. I promise you I wish I could answer that for you. But I do think it's probably worth noting that the president, who originally had put out a 15 days to slow the spread of the virus, which was up yesterday, his initial 15 days, which included the requests and the requirements of social distancing, etc. He extended that from 15 days, which ended yesterday, all the way out until April the 30th. And so while that is not a drop-dead date, and he certainly has the ability to change that and either lessen it or expand it, I think that should put people in Mississippi that are wondering when this is going to be over. I don't think for most parts of the country, April the 30th is the day that is going to be over. And so keep that in mind. It's the reason that we are putting certain orders in effect with end dates so as to slow the spread and maintain the integrity of our healthcare system. So with that, I'm going to ask Dr. Byard if you would just talk a little bit about the strategy with respect to what we're doing in Lauderdale County and how you expect that to function.
Thank you, Governor. And first, let me thank the Governor and how grateful we are for all of the support that we've received from him and his office in our continued aggressive response. So, as the Governor indicated, the shelter in place is not done by itself. It is part of an overall strategy to interrupt transmission. Parts of that are the increased testing. The more we identify those cases, the more that we can implement contact investigations, we can implement case investigations. Once we identify those individuals who are cases, we appropriately isolate them and quarantine their contacts. These are strategies that we use in any number of infectious diseases, and we know that the way that this virus transmits is through that close transmission, typically within 6 feet or less. And so we want to try to expand the distance between people. This is how we can interrupt transmission, how we can effectively reduce the number of cases. And so, with those aggressive activities that we'll continue to do, those include what we talked about with the case investigation. We know that recently, and if you've seen our numbers that we've released today, that we have seen an increased number of cases within Lauderdale County. Now, as the Governor indicated, this is not a county with the highest number of cases, but it is a county where we are watching those cases, and we've seen a rapid increase over the last 48 to 72 hours. This is an indication of an opportunity for us to put in place additional measures. If we can interrupt transmission, we can then begin to effectively utilize this in other areas. As the Governor indicated, we're looking at other counties. We're looking at other areas in the state as targets for potential shelter in place. But that doesn't mean that we're not doing those other activities as well. We're increasing our testing throughout the state. We are increasing our capability to do contact and case investigation. And so, I think it's important for everybody to understand that we're in this together. We all have a role to play. And for the shelter in place aspect, that means limiting your contact. This is a way that we can all take responsibility for ourselves. If you're sick, stay at home. Contact your providers. Access the testing clinics that are going to be available. If you're ill enough to be tested for COVID-19, then you should go ahead and isolate immediately. You should not wait for the results to determine 2 or 3 days later, once you get the results back, if you're actually positive. You need to go ahead and take that action up front. So this is another reminder of the role and the actions that we can all take to protect everyone. We know that there are vulnerable individuals in our population. We know that individuals who have underlying chronic medical problems, individuals who are older, especially over the age of 65, those are the people that we're going to see most of the hospitalizations in. That's where we see most of the deaths. We want to all do our part to not only protect ourselves and our families, but to protect those vulnerable populations as well. Thank you, Governor.
Thank you, and I just want to reiterate what Dr. Byers just said. One of the challenges in Mississippi is that those individuals that fall into the more vulnerable categories, those with pre-existing medical conditions, those who have compromised immune systems, those who are 65 and older, those who are the highest at risk, let me repeat, not the only ones at risk, but those who have the highest risk. Mississippi has a higher percentage of those than most other states. That puts us in a particularly challenging environment. It's the reason for weeks and weeks on end, I have been urging all of our senior adults, those over the age of 65, in all communities, those who have compromised immune systems. And some have said, well, what do you mean when you say compromised immune system? If you have had cancer and done treatment, you probably have a compromised immune system. Again, I'm not a medical professional, but in talking to our professionals, that seems very clear to me. We've had, if you have had major medical problems and challenges, it is in your best interest, in the best interest of the state as a whole, that you shelter in place yourself. Don't go out and contract this disease and this virus because you are at particular risk. And when we look at the number of deaths in places like New York, etc., again, the large majority of those who are passing away from this are those that fit into that category. So please, please stay home, practice social distancing when you must go out, and let's all work together to be careful and to protect ourselves, and realize that if you're 35 or 40 and in great shape, and therefore you think you can go out and if you contract the virus, it's not that big a deal, just keep in mind you could give it to your mom or your grandmom or your dad or your granddad, and you could be putting them at risk. And so please be cognizant of your surroundings and take care of yourself. So with that, we'll start with questions, and I'll start with Courtney Ann.
Can you tell me, I know that the investigation will continue, but is there anything that has happened in Lauderdale County, whether it be an issue with folks gathering, funerals, weddings, that we've been hearing about have been issues that we think may have led to this quick spread?
Well, first of all, let me say that we should not be having funerals with more than 10 people. We should not be having weddings with more than 10 people anywhere in the Mississippi, because that does not comply with the executive orders that we have already put in place. I'll let Dr. Byers speak to the specifics in Lauderdale